Thank you, Mr. Chairman. Thank you all for being here in the dialogue about Alzheimer's. This is important to my family as well as just about everybody on this dais has talked about how Alzheimer's has affected their family directly. And thanks for your story, be able to walk through that. Let me ask a question about a worldwide look. We're spending billions of dollars on it, federal tax dollars, working on brain mapping, research, all kinds of diagnosis, treatments, everything else. Who else is doing this worldwide? Where else is there significant research going on, and what are you seeing?
In Europe, has also made a substantial investment in this space in their research. The European Union, there's an investigator group there called EPAD, European Prevention of Alzheimer's Disease Initiative. And Japan has made tremendous investments in the delivery of care, particularly robotics, for example. Yeah.
Do we have enough coordination?
Yes. NIH funded a grant called the Alzheimer's Disease Neuroimaging Initiative. We all call it ADNI. And it was it's ongoing, and it has been validating the biological markers of Alzheimer's disease. It's one of the it's almost like sort of writing the encyclopedia or the dictionary of Alzheimer's. And ADNI became a model for ADNIs throughout the world. And so if you look across other countries like Australia, Korea, Japan, and Europe, there are similarly modeled ADNI studies doing similar kinds of measures, et cetera, so you can begin to compare across countries, across databases, how these cognitive measures, biomarker measures, functional measures compare. That was our innovation that we then exported.
Yeah, as it should be for us to be able to work together on this. There'll be individuals in Japan that'll take on this issue different than those that are in Europe, different than those that would in the United States. And as we each do our individual research, I just want to make sure there's enough cooperation and that there's no barriers to coordination on working towards a solution.
Yeah, I mean, the annual meeting of Alzheimer's researchers, AAIC, is truly an international meeting. This year, in fact, 2020, I should say, it's the next meeting will be in Amsterdam. The meeting just before that was in Los Angeles. So yeah, no, this is we're all in this together. Disease.
Yeah, I would assure you that's true for us, at least for all the families that have been affected as well. Let me talk a little bit about care coordination and the barriers around care coordination. Family members are trying to get answers while they're trying to also take care of family members as they walk through the process and trying to be able to work through a physician or through a nurse or through a facility that may provide housing. There are lots of questions there. What are you finding as far as ways that can be improved? What are the barriers to care coordination and getting answers?
Yeah, so I think that there's, a significant number of barriers. One, there's, a fair amount of difference in funding at the local level. And I know we're here at the federal level, but the reality is that much of the funding also comes through at the state level. And so, helping to kind of look at that, I think, is important. I think we talked about earlier the fact that people just don't know what resources are out there. And I think we need to continue to kind of educate that. We've approached it from a perspective of a non-physician role. So I think there really are non-physician roles that are important. We actually have what we call a non-licensed community health worker. Many folks have used community health workers over the years, but we've really used them to be really the connector to the community. They work in their community, they hit the streets in their community, so to speak, so that they know all of the resources that are in their community. I think it's about connecting the families to those resources sooner rather than later so that they can understand what they're going to need. The other kind of last point I'll make is anticipating the decline. So a lot of times we wait until the family gets exhausted and then we're kind of running around trying to put a plan in place. We talked about a plan of care earlier, and so I think really thinking much more aggressively about advancing illness that we talked about earlier, and helping the plan to or the family to understand the changes that are likely going to come, I think is important to get up front so that the families have the respite that they need.
And obviously, the reasonable person to be able to answer those questions initially, to be able to connect to them, is a physician or a nurse or someone that's there around diagnosis, to then try to figure out how do we help provide a connection to services. Is there a barrier to getting that information to physicians and nurses to get them the information to be able to help them know where to go next?
No, I don't think so. I think if you work in a team environment, so organizations that have a team approach where you've aligned either social workers or community health workers that really know the community and then can link it to the physician, through to the team, I think it really comes down to primary care and specialty care teams that really leverage non-physician workers.
Yeah, I mean,
Thank you, Mr. Chair.
at the Memory Center, very quickly, we, when I have a diagnostic follow-up visit, it's myself, the patient, the family member, and one of our social work team in the room. I deliver the diagnosis, answer their questions, et cetera, and then they go off with the social worker to continue the discussion around the care plan. So that means we have to have 4 chairs in the room, at least.